Welcome to Hersing University NU 640, Introduction to Women's Health Across the Lifespan. This video will discuss Chapter 7, Women's Bodies, Women's Health from your Alexander and Colleagues textbook, as well as Chapter 1, Anatomy and Physiology from your Secker and Holland textbook. This discussion will serve as a brief overview of the material. Therefore, I would like to ask that you please read the chapters for additional and required information. Additionally, I would like for you to review all other required and supplemental resources.
Women are encouraged to be knowledgeable about their bodies, to appreciate the unique form and function of the female body, and take responsibility for caring and making decisions about their bodies that will positively affect their health. This presentation will review female anatomy and physiology in terms of how it directly affects gynecologic health and well-being. The reproductive systems of male and female have some basic similarities and some specialized differences. They are the same in that most of the reproductive organs of both sexes develop from similar embryonic tissue. Both systems have gonads that produce sperm and egg or ovum and sex organs. And both systems experience maturation of their reproductive organs, which become functional during puberty as a result of the gonads secreting sex hormones. In the female, the urinary and reproductive systems are completely separate, unlike in the male. The differences between the female and male reproductive systems are based on the functions of each individual's role in the reproduction cycle. A male who is healthy and sexually mature continuously produces sperm. The development of women's eggs are arrested during fetal development. This means she is born with a predetermined number of oocytes and cannot produce new ones. The ovaries of a newborn baby girl contain about 1 million oocytes. This number declines to 400,000 to 500,000 by the time puberty is reached. On average, 500 to 1,000 oocytes are ovulated during a woman's reproductive lifetime. When a young woman reaches puberty around age 10 to 13, a primary oocyte is discharged from one of the ovaries every 28 days. This continues until the woman reaches menopause, usually around the age of 50 years. Oocytes are present at birth and age as a woman ages. We will discuss the woman's reproductive cycle in more detail in a separate presentation. The breasts are modified sebaceous glands contained within the superficial fascia of the chest wall, located over the pectoral muscles. Each consists of a nipple, lobes, ducts, and fibrous and fatty tissue. Each breast is composed of 15 to 20 lobes of glandular tissue. The number of lobes is not related to the size of the breast. The lobes then branch to form 20 to 40 lobules, which are subdivided into many secreting alveoli. These glands are connected together by a series of ducts. The alveoli produce milk and other substances during lactation. Each lobe empties into a single lactiferous duct that travels out through the nipple. Fatty and connective tissues surround the lobes of glandular tissue. The amount of fatty tissue depends on many factors, including age, percentage of body fat, and heredity. Cooper's ligaments connect the chest wall to the skin of the breast, giving the breast its shape and elasticity. The size of the non-pregnant breast reflects the amount of adipose tissue in the breast rather than the amount of glandular tissue. The nipple and areola are located near the center of each breast. The areola is the pigmented area surrounding the nipple. These areas usually have a color and texture that differs from that of the adjacent skin. The nipple and areola are made of smooth muscle fibers and feature a thick network of nerve endings. The areola is populated by numerous oil-producing Montgomery's glands. These glands may form raised bumps and be responsive to a woman's menstrual cycle. They protect and lubricate the nipple during lactation. Your Sarkio and Sikora textbook offers this chart on page 5 that discusses the structures, functions, and purpose of reproductive organs. The vulva is the externally visible outer genitalia. It includes the mons pubis, labia majora, clitoris, urinary meatus, vaginal opening, and vestibular bulbs of the labia minora and perineum. The vestibule is inside the labia minora and outside the hymen. On each side of the vestibule is a Bartholin's gland, which secretes lubricating mucus into the introitus during sexual excitement. The term vagina is often improperly used as a generic term to refer to the vulva or female genitals, even though, strictly speaking, the vagina is a specific internal structure and the vulva is the exterior genitalia only. Calling the vulva the vagina is like calling the mouth the throat. The mons pubis is a soft mound at the top of the vulva, which is the fatty tissue covering the pubic bone. The mons pubis protects the pubic bone and vulva from the impact of sexual intercourse. After puberty, it is covered with pubic hair, usually in a triangular shape. Heredity can play a role in the amount of pubic hair an individual grows. The labia majora are fused anteriorly with the mons pubis or anterior prominence of the symphysis pubis and posterior with the perineal body. They are pads of loose connective and adipose tissue as well as some smooth muscle. They assist in keeping the vaginal introitus closed, which in turn helps prevent infection. The inner surface of the labia majora consists of scent, oil, and sweat glands that serve to lubricate as well as stimulate by releasing a classic female musk scent during sexual arousal. The labia majora are heavily pigmented and the outer surfaces are covered with hair in adult women, whereas the inner surfaces are smooth and hairless. In postmenopausal women, the hair of the labia becomes thinner and the labia and mons appears less full as a result of loss of fatty tissue. The labia minora are surrounded by the labia majora and are smaller, non-fatty folds covered by non-hair-bearing skin laterally and by vaginal mucosa on the medial aspect. The anterior aspect of the labia minora forms the preface of the clitoris and also assists in enclosing the opening of the urethra and the vagina. The clitoris, visible as a small white oval between the top of the labia minora and the clitoral hood, is a small body of spongy tissue that functions solely for sexual pleasure. Only the tip or glans of the clitoris shows externally, but the organ itself is elongated and branched into two forks, which extend downward along the rim of the vaginal opening toward the perineum. The clitoral glans, or external tip of the clitoris, is protected by the clitoral hood, a covering of tissue similar to the foreskin of the male penis. Skene's gland are tiny, clustered periurethral organs, the ducts of which open laterally and posteriorly to the urethral orifice. The Skene's glands, which release mucus, form a triangular area of mucous membrane surrounding the urethral meatus from the clitoral glands to the vaginal upper rim. The pea-sized Bartholin's glands are located at about the 5 and 7 o'clock positions in the vulvovaginal area just beneath the fascia. Each gland has an approximately 2 centimeter duct that opens into the groove between the labia minora and hymen. The glands, which are made of columnar cells that secrete clear or whitish mucus, are stimulated during sexual arousal. If the Bartholin's ducts are blocked, infection can occur, resulting in cyst formation that can lead to the development of an abscess, which will require surgical incision and drainage. The opening to the urethra is just below the clitoris. Although it is not related to sex or reproduction, it is included in the vulva. The urethra is actually used for the passage of urine and is connected to the bladder. In females, the urethra is 1.5 inches long compared to males whose urethra is 8 inches long. Because the urethra is so close to the anus, women should always wipe themselves from front to back to avoid infecting the vagina and urethra with bacteria. This location issue is the reason for bladder infections being more common in females. Be sure to educate your patients in regards to this matter. The hymen is a thin folded membrane of connective tissue that separates the lumen of the vagina from the urethral sinus. Sometimes it may partially cover the vaginal orifice. The perineum is the last external genital we will discuss. The perineum is a short stretch of skin starting at the bottom of the vulva and extending to the anus. It is a diamond-shaped area between the symphysis pubis and the coccyx. This area forms the floor of the pelvis and contains the external sex organs and the anal opening. It can be further divided into the urogenital triangle in front and the anal triangle in back.